for those of you who are doctors, the verb from the Latin docere means to teach. That's what we are as doctors. So it's a matter of teaching our patients, and I noticed that as I teach and I explain to patients what it is that we're doing and the excitement that we have, more referrals come. So if you'll teach a little bit each time you're with your patient, you'll notice your practice improve. So arthritis is something that it just covers so many people. All of us will have it by the time we end up in the grave. It's a degenerative process that kind of happens as part of us breaking down, but it doesn't have to happen to such a degree. We'll discuss tonight ways in which we can actually diminish this degenerative process. So there's basically two kinds that we're going to talk about, two different types of arthritis, degenerative and rheumatoid. And I specialize in basically the triangle of health, which is structure, emotion, and physiology, which kind of is something that you all probably practice within. And I think this tells it all. Inflammation basically is a breakdown. It's creation of heat, redness, swelling. I love that. Pain, it's a stubbed his toe, and loss of function. Arms are falling off and here cracking up. So, of course, arth means the joint or the prefix means joint, and itis means inflammation. So inflammation of one or more of your joints. But the thing is, I think we can get that inflammation. Arth just means itis within the joint, but you can have itis anywhere in the system. This is pretty interesting. 42.7 million Americans have doctor-diagnosed arthritis. 1 million new patients develop each year. Approximately 300,000 children have juvenile arthritis. This is a big one, and this is a sad thing. But I really feel that this part right here, that 300,000, is coming from leaky gut syndrome because of the garbage we feed our children, and I would suggest the effect of our immunizations. 2 of my children are fully immunized. The third one, after I got into practice and saw what was happening to children that I treated, my third is half immunized, and my fourth is not immunized at all. Until just recently, she's planning to go on an LDS Mormon mission here in a couple of years, and so she's having to get some of her immunizations done. But you know what? She's not a kid anymore, and she's got a stronger functioning liver, and that won't be such a deal. 40% of the population over 65 have arthritis. I think that's higher than that, but that's what was reported. Arthritis costs the U.S. economy more than $86.2 billion annually. At least 25% of general practitioners' time is spent on a general practitioner treating arthritis-related diseases. So this is something that's big. 25% of your practice is somebody has joint pain. So common symptoms: fatigue, joint pain, joint tenderness, joint redness, joint warmth, stiffness of the joints, particularly in the morning because they've had all night to stove up. Decreased range of motion. Rheumatoid, on the other side, similar as these over here, but usually not always joints affected on both sides of the body. And there's a telltale sign that the way the Heberden's nodes here, you can see those twisting of the fingers, that's usually rheumatoid. Small joints, hands, wrists, and feet, also knees, ankles, shoulders, hips, and elbows. But that's more of the rheumatoid. So we're going to discuss both of these and why they happen. So let's osteoarthritis. At first we'll just talk about the degenerative type. So most common type of arthritis is degeneration of the joints from overuse, or as a chiropractor, I focus on positioning and function of the joints. So as they're in a better position and better motion, they don't wear down as quickly. So malpositioning will cause, the curvature will cause vertebrae to wear down. So if there's a scoliotic curve here, there's more pressure on the sides, on this side, and we'll notice here in a minute, we talk about Wolff's Law, that there's a negative charge that builds up on the side of concavity of the vertebra, or where there's more pressure. This can be concavity of whatever joint you're talking about, and when that negative charge builds up, it will draw positive ions to it, which minerals are positively charged. So minerals will deposit on that side of convexity here, concavity. Convex is over here. So we want to get in there and do the best we can at leveling things. Now this is, I didn't get a picture of some x-rays here, and I apologize, but this is a pretty good picture, and we can notice here that this would represent an uneven sacral base, that sacrum right here is unleveled to the left, which makes this person turn to the left a bit, and ultimately then in the upper thoracic spine curving to the right. So we'll be discussing that positioning and how we can level this as chiropractors, or you can refer to a chiropractor if you're not one, whatever. But osteoarthritis can be affected much by position and function of vertebra. So in the spine, misalignments, scoliosis, and here with the foot pronation, pronation means that your ankles are dropping inward, that the medial malleolus is dropping towards the center, and that the talus, which is the top bone, if you will, in the bones of the foot that connects onto the tibia, that has moved medially as well towards the inside and dropped. This is what we call pronation. And I find that 90% of the cases, the more pronated side will result in the sacrum being shorter on that left side, or on the side of shortness, or the side of pronation. So if this patient over here is pronating on the left more so than the right, 90% of the time I find, out of 22 years of practice, this side of pronation is going to be the side that the pelvic or the sacrum tips towards. So by putting in that a lift, an orthotic and a lift on that left side, the lower side, it's going to raise and make this sacrum level. That's something we can talk about. If you're interested, call my office and I can help you understand more if you want to know more there. But here I talked about the negative electric charge. That's what builds up, and those minerals then are what the problem, the deposition there. So here's Dr. Wolf, 1836 and 1902, the law of transforming of the bone, he called it. This was Wolff's law. Wherever there is an increased pressure on the bone, the body will produce extra calcium or minerals to support that area. So if we have sliding forward of the vertebra, or we have a curvature, we'll start to deposit in a bone spur that extra calcium. So we'll see more calcification on, like I mentioned, on the side where that's curved. On a foot that's pronated, you're going to notice that the big toe will laterally deviate. It will deviate to the outside. So then you have malposition of the big toe, and sure enough, calcium deposition on the medial part of the toe. Well, no big deal. We just go in and cut that out. We forget that it's part of that dropping of that arch that causes that malposition. So therefore, osteoarthritis is an overused degenerative process for malpositioning or malfunctioning of that joint. Rheumatoid arthritis is different. It's an autoimmune issue. So joint tissues recognized as abnormal, which creates inflammation. These joint tissues are being recognized as abnormal because the body recognizes that protein as abnormal. And the concept that I've learned is that leaky gut syndrome, and really guys, are you tired of hearing me talk about leaky gut syndrome? For the last 5 webinars now, leaky guts come up. Well, in my opinion, it's one of the top priorities that leads, I would say, to, it is the creation, the cause of most of all of the issues that we face, or at least a contributing factor to. So why would this joint here, why would this joint tissue be considered abnormal so the body's own immune system is fighting it? Well, leaky gut, as we'll discuss here in a minute, leaky gut allows those toxins to pass through. Well, let's just go right to it. So here we go. We've got a protein leaking through the gut that should not be getting through. In this position, in this first healthy gut, it doesn't do that. But here where we've got leaks or fissures, openings, these proteins can make it through. Now the antibodies recognize, hey, wait a minute, this is a chunk of chicken. This is chicken carbon. This is a chicken chain of protein, and it should be an amino acid at this point. So the body then will send antibodies towards this, and we get what's called an antigen-antibody complex. Antigen means abnormal tissue, abnormal stuff. The antibody connects onto it, and now you've got an antigen-antibody complex that then is now in the blood supply. It's just kind of cruising around like my pointer here, and it will settle out into the capsule. It'll settle out, that antigen-antibody complex settles out within the joint capsule, which doesn't have much movement like the arteries and veins do with blood. So things that get deposited in those joint capsules, they create what's called pannus. So pannus formation, we'll discuss that here in a second as well. Pannus formation is just that, it's like joint junk, okay? So the autoimmune response, foreign proteins recognized as abnormal proteins, those are attacked by the antibodies. Antigen-antibody complexes get stuck and create that pannus. So, again, pannus would be like putting sand within the joint. So this is a different concept than the degenerative. Okay, this is more bodies fighting it, creating an inflammation. All right, so the key formulas that we treat as we go through the degeneration is motility. Motility is supports, and we'll discuss, it helps so much at repairing the joint capsule and tissue. I suggest digest as well on an empty stomach. This helps to digest things in the blood supply and anywhere in the system. It helps get rid of stuff such as proteins, carbohydrates, fats that are depositing in areas. So this helps clean up joint tissues, helps clean up stuff that's in the blood. CalComp is a very bioavailable calcium, mineral, vitamin support we'll discuss. Thyroidin I use as well because it supports the deposition of calcium and minerals as it supports the parathyroid. And Vivaprofen supports, it's an antibacterial as far as it fights bacteria in the gut while it's getting rid of inflammation and reestablishing good bacteria. Holy smoke, guys, this is a great one. This is a great, great product for supporting and repairing gut tissue. So let's discuss now motility. It's critical healthy joint nutrients, glucosamine, chondroitin, anti-inflammatories, collagen, vitamins. Wonderful support for joint tissue. So we're thinking about also, and I didn't write this down. Well, we did it. We'll discuss it in a minute. Layers of infection. Layers of infection can create leaky gut syndrome, but you can also get layers of infection within the joints themselves. Microparasites, viruses, bacteria. So also make sure that as you're working with your arthritic patients that you're checking to see somehow using kinesiology or the electrodermal screening or any of the blood work you might have access to determine what might be inside that joint. Because then we can go after that with the different layers of infection. So key components of synovial fluid around the joints, that's what this supports, and it's uniquely plant-based. Of course, everything in the line of Inno-Vita is plant-based, is non-glandular, non-animal glandular. So that's motility. The digest, again, that helps to remove the pannus formation here. It helps to remove toxins and cellular debris as it's digesting and getting things to move. So it helps by its own digestive mechanism for digesting food, but taken on an empty stomach, it helps, it's absorbed through the tissue, through the gut, and increases that that irritation. The CalComp, bone composition strengthens, bone remodeling. It basically supports the osteoclastic or blastic activity for repairing and rebuilding of bone. Very bioavailable source. So many people are concerned about taking calcium because it will create kidney stones and so forth. This is a different way that it's put together. So you don't have to worry about that creating stones and plaque. One of the problems that we have is as we get older is creating too much calcium where it shouldn't be, and we become stiff, hard, so forth. And it also works with muscle tissue tone, nervous system, and enzymatic reactions. That's CalComp. Thyroidin, and again I talked about that because it supports the thyroid. Parathyroid gland regulates minerals and calcium absorption in the bone. It also works with growth hormones supporting the endocrine function of bone formation, the osteoblasts and adipocytes as well. So that's the thyroidin. And then the Vivaprofen destroys the pathogenic bacteria. It has the anti-inflammatory aspect of in the gut stopping the inflammation, and basically throughout the system, out throughout the body. and it's also targeting the probiotics. So this one, as we're working in leaky gut, this one's shutting off the inflammation, fighting the infection, and reestablishing good bacteria. So I usually have them take one of these, one a day of ibuprofen, and the other one is fluorescein, and fluorescein is a good amount of a large amount of bacteria, good bacteria, that make it through the gut acidity, designed so that it's coming through and breaking apart once it's into the large and small intestine. Again, like I mentioned, always, whenever you're thinking about working on an organ or a symptom, a disease, arthritis is not a disease, I don't think. I don't think anything's a disease. There's a reason for it. Diseases are named groups of symptoms. But when you're working on a particular organ, you're always going to ask, is there an infection? That's one of the questions we ask. Is there any kind of layer of infection? Again, I've talked about that previously in previous webinars. Layers of infection are smaller amounts of infection. We may have 5 or 10% count of bacteria. That's basically negligible on any kind of blood work, but it's there, and it will create degeneration. So here's our work, back to works for the bacteria. Metals, Meta-X, heavy metals, chemicals. Microcyte is for microparasite. Paramac is for large parasite. Fungex for the funguses, and Virox for both RNA and DNA type viruses. So this supports your own, the patient's own body in creating its own ability to fight. Okay, it's supporting their own warriors instead of borrowing the warriors of somebody else in antibiotic therapy. Okay, so those are the layers of infection. So now this would be what I would recommend, how much to take. But again, every time you're checking anybody, always, if you can, use kinesiology. If you don't know kinesiology, call Inno-Vita and they will get you a DVD that we created on a very simple way to do kinesiology. But to me, you're guessing unless you have some way to check in to query the body as to what that body can handle at that time. So CalComp 1 to 4 capsules one time per day. That's the mineral support. Thyroidin, 1 capsule 4 times a day. That regulates the mineral uptake. Motility, 1 4 times a day. Digesta, again, now this would be empty stomach for cleaning the blood, cleaning the pannus formation out of the joint. For cleaning up, you take an empty stomach. For digestion of your food, of course, you take it with your food, and that will digest more effectively. They say above 30 years old, you should take a digestive enzyme, that we diminish our ability to digest by our age. And then the Adrenex I added at the end for the rheumatoid, because Adrenex helps the adrenal glands, and adrenaline are anti-inflammatory. They're natural anti-inflammatory. So it's very effective to do the adrenal gland, and most everybody is deficient here. So I threw in the rheumatoid as well on the Adrenex, just helping shut down some of the body's inflammation.